Welcome to Science Easy Tech channel. In this video, we are going to discuss about through experimental design. Under through experimental design, we have many types. Out of that, we are going to discuss post-test only design, which is otherwise called as after test design, or pre-test post-test design, which is otherwise called as before and after test design. This video is taken from the subject Nursing Research and Statistics. This video is useful for BSc Nursing students, post-basic BSc Nursing students and students who are studying MSc Nursing. Before moving on to the topic, if you are new to Science Easy Tech channel, just take a moment to subscribe our channel and also to press the notification bell icon in order to get connected with our latest updates. Let's move on to the contents, what we are going to discuss in this video. Through experimental design, its types, post-test only design or after only design, pre-test post-test design or before after design. See, types of through experimental design. There are many types. Post-test only design, pre-test post-test only design, Solomon 4 group design, factorial design, randomized block design, crossover design. Why I have marked from 3 to 6 is because the Solomon 4 group design, factorial design, randomized block design, crossover design already we have discussed in our channel. So if you have not watched those videos, I have given the link in description box, suggested end card and I card of Nursing Research and Statistics playlist. So now we are going to discuss only post-test only design and pre-test post-test only design, its advantages and disadvantages. First, see post-test only design. Post-test only design is otherwise called as after only design. So it is composed of after test only design. It is composed of two randomly assigned group, experimental and control group. When we are telling through experimental group means it should satisfy three criteria. What are those three criteria? First criteria is randomization. Second criteria is you should have an experimental group and you should have a control group. Third criteria is manipulation or treatment should be there. So here for the two experimental group as well as control group, you are randomly assigning the subjects. You know which subjects are going to experimental group and which subjects are going to control group. Then what you have to do, you should not do any pre-test for experimental group and control group, but intervention is given for experimental group and not to control group. So intervention or treatment is given only to experimental group and not to control group, but you are doing post test to both the groups. Okay, both experimental group and control group you are doing post test. So next, this design is helpful where in situations where you cannot do pre-test for the subjects and you are doing post-test in experimental group mode. No, so you are assessing the effectiveness of your intervention on the post-test. Example, a study on educational intervention related to contraception among couples. So here the couples are assigned randomly to experimental group and control group. There is no pre-test as I have told earlier. But what you are giving, educational intervention is provided only to experimental group couples and not to control group couples. Then after giving the intervention to experimental group, after a period of time you are doing post test. So post test you are evaluating. So post test you are giving and you are evaluating, but the post test is given for both the groups, that is experimental and control group. So this is post-test only design. See here, randomly you are assigning subjects to experimental group and control group. Then you are giving a treatment. Then you are giving post-test. So post-test is given to what? Post-test is given to both experimental group and control group. See here, treatment is given only to experimental group but not to control group. Control group you have not given any treatment. Okay, so as per the example what we have discussed earlier, so here we are randomly assigning the couples to experimental group and control group. Then the educational intervention is given only to experimental group and not to control group. Then you are conducting post test both on experimental and control group. Okay, so next let us see the advantages and disadvantages of post test only design or after only design. So here advantages is it can be done where pre-test is not possible, as I have already mentioned, and it is not affected by reactions of pre-testing. Suppose if you are going to do pre-testing, sometimes by curiosity you will be learning the answers for those, so you cannot tell only because of your intervention they have gained knowledge. So that pre-test will affect the post-test values. The treatment and control groups, they should be equivalent at baseline. The treatment, because you are not giving any pre-test here, so they are both equivalent at baseline data. Okay, then external threats or external factors or controlled or minimized. So there are internal threats, external threats. Out of these, external threats are controlled. So with regard to internal and external threats, I will put a separate video. Disadvantages, you need large sample size. Okay, large sample size is needed for doing this thing, and also less generalizability of findings, because you are not doing any pre-test. You are giving intervention to one group, that is experimental group, and you are finding post-test for group 4 groups. Suppose if you had a pre-test data, for example, to assess the knowledge on diabetes mellitus, you are doing a study, means in pre-test, suppose if the scores are 12 out of 30, after post test it has been increased, after intervention it has been increased to 25, then you can tell very well that in the pre-test the values are very low, but because of my intervention the values in the post test has raised up. So confidently you can generalize the findings, but here since the pre-test levels we are not doing, so we cannot generalize the findings to a large group of population, and there is a chance for bias, not able to clearly explain the treatment effect. As I have told, because of your treatment only the scores have increased, we may not be able to tell. Next is pre-test, post-test only design. In this design also subjects are randomly assigned to both experimental and control group. Then only it comes under through experimental design. So through experimental design should satisfy 3 criteria. What are they? There should be a control group and experimental group. There should be randomization of assignment of subjects, and finally manipulation or treatment. So here the effect of the dependent variable of both the groups is seen before and after the treatment. So here it clearly tells what you are going to conduct the pre-test. So following, first you have to conduct the pre-test for experimental group, control group. Then you have to give intervention only for the experimental group and not for the control group. Then you are going to do the post-test. So here you can very well tell, see the pre-test values intervention and post-test values are more effective. Okay, so in pre-test they are having some 15 marks out of 30, means after giving intervention it has rise to 25, means very well you can tell that it is because of the effectiveness of your intervention. How you can compare? By means of a control group, where in control group only 15 pre-test score, for example, means again in post-test it can be 16 or 17, or it can be less than that also. So you can very well tell that because of your intervention only in experimental group the scores has increased, but not in control group. So here, for example, an experimental study to assess the effectiveness of cognitive behavioral therapy interventions for patients with breast cancer, or an experimental study to assess the effectiveness of structured teaching program on diabetes mellitus foot care. Okay, on diabetes mellitus foot care among patients with diabetes mellitus, like that you can give different examples. So here, as I have told earlier, randomly you are assigning subjects to experimental group and control group. So here pre-test is conducted for both experimental and control group, but only treatment is given to experimental group and not to control group. And finally post-test is conducted to both experimental and control group. Okay, so what is the difference between this and post-test only design? Means a post-test only design, there is no pre-test. But here pretest is there. Rest all same, only intervention is given to experimental group and post test is conducted in both the groups. Okay, so here only criteria difference is you are conducting both the pre-test and post-test. Advantages: controls for all internal validity threats. So I told there it controls external validity threats in post test. No, here it controls internal validity threats. So with regard to internal and external validity threats, I will be posting a separate video. Then controls for initial differences by adjusting post test score statistically. So pre-test values or pre-test data will be acting as a baseline for you. Next, disadvantages: external threat or reactive effects of the pre-test. So there may be chances of external threats and can only generalized to situations where you can do pre-test. So where pre-test is possible, there only you can generalize your findings. So this is with regard to the disadvantage. Hope this video has given a detailed explanation about pre-test and post-test only design as well as post-test only design. You can watch our channel playlist for more nursing research and statistic related videos. We have created a separate playlist for statistics also. Thank you friends. Keep supporting to Science Easy Tech channel.